Welcome to JustWannaQuilt, a research podcast coming out of Tulane University Law School, where we explore all kinds of things, stories about quilting, tools, field trips, maybe some famous quilters stop by, and, of course, a little bit of copyright thrown in just for fun. I'm Elizabeth Townsend Guard, your host. I'm a law professor at Tulane University Law School. I also have two fellowships now, one at the Business School, a LePage Faculty Fellow, and one at the Newcomb Institute, the Greenbaum Fellowship, both at Tulane, and I just want to quilt. Today we talk to Alexa Mageri. She is a Ph.D. student in health economics at UC Berkeley School of Health. She is also a crafter. She calls herself, she's got a blog called Wannabe Grandma. And she has started a list of all the hospitals that are requesting homemade masks. It's amazing. She needs our help. She's telling us what it is, and it's really interesting. So a crafter and a public health PhD student, it's an interesting hour. Yeah, that makes sense. That's very cool. What kind of, you said he did the Underground Podcast Network?
Yeah, so he runs the Underdog Podcast
Network.
He does mostly sports, but they've started branching out a little bit.
Interesting.
But he's been podcasting for like 10 years or something like that. And we've been together 6 years, and I think it's so funny that this is my first podcast.
That is funny. I like that. That's very funny. Well, cool. Well, this is Just Wanna Quilt, and as you know, quilters are being called into action this last week to help with masks, and I know you're part of it. We're going to start first with two simple questions. And I thought we'd go for about 20 minutes to a half hour, if that works for you.
Yep, that's great.
Okay, fabulous. First, I know this answer, but can you tell me your name and where you're calling from?
Yeah, my name is Alexa Mageri. I currently live in the Bay Area of California, and I'm originally from Cleveland, Ohio.
Oh, interesting. And you're at Berkeley right now, right?
Yeah, so I'm a PhD student in health economics at UC Berkeley School of Public Health.
Interesting. And what is health economics?
So health economics is basically, when people think about economics, they think a lot about the stock market and dollars and cents, but I think about economics as a mathematical framework for thinking about human behavior, and I specifically use this framework to think about questions related to healthcare. My main focus is physician behavior and how physicians perceive distance between patients.
Very interesting. And what happens when you finish your PhD? Where do you go with this kind of PhD?
So a lot of people go into academia, but there are a lot of opportunities in government and the private sector as well. So working for health insurers, working for Medicare and Medicaid services, doing consulting. There's really lots of opportunities, especially in this day and age, but the main skill that we have, marketable skill, is coding and running regressions and things like that.
Interesting. Super interesting. Okay, so we have to ask you a second question, and then we're going to get back to you, which is, do you have any memory of anyone sewing or quilting, or do you do that yourself at all?
Yes. So that's how this whole project sort of took off. I have my own little blog that I started a little while ago called the Wannabe Grandma, and it's because for my whole life, like, my fondest memories were of spending time crafting and baking with my grandmothers as a little girl. And so my greatest aspiration in life is to be the world's greatest grandma. So I started the Wannabe Grandma, where I share some of my projects, and that's how I was exposed to this call for quilters and sewers to make face masks.
Yeah,
and
I'm on your website right now. It's your blog. It's adorable. It is really great.
Thank you. Thanks. Yeah, and so I felt that I was uniquely positioned with one foot in the craft world, and one foot in the public health space to sort of bring those two worlds together to hopefully do some good.
So very interesting. Now, how did the people who are in public health, like, did they know that you wanted to be a wannabe grandma before the last week?
So my close friends definitely did. I'm known to bring baked goods and things like that to some classes or social gatherings with my colleagues. So they definitely knew about it. But I think others that aren't as close are finding out as we're going here.
Yeah. Okay. So you started a list that's a Google Doc for hospitals requesting homemade masks. Tell me how that started. Well, what I want to know is what you're finding. And then in the end, I also want to know how we can help, because this will get posted today. And and also sort of how can we as quilters help you with this list if you want help?
Yes, great. So the list got started basically because, like all of you guys, I am a member of lots of different Facebook groups for crafters, and I saw sort of a very motivated group of individuals who clearly are really passionate and are answering the call to help right now, which I thought was so wonderful. But I also thought it was a bit chaotic, right?
Yeah, I agree.
So many posts and so many groups, and like so many people are just furiously making masks right now. But if you think about, and going back to economics, like the laws of supply and demand, like we really, really want to supply the greatest demand right now, right? Like to make the biggest impact as quilters, like we want to understand the demand from the healthcare system, and we want to understand how we can have the greatest impact. So I have the fortune to have access to databases of hospitals through my work, cool. And sort of the know-how to find publicly available hospital lists. So I just texted one of my colleagues, and we came up with the most recent hospital list that we could find. There's about 5,100 hospitals on this list throughout the country, and we sort of pared it down to those that are most likely to be needing help. So those that have ICUs are most likely to have the more severe COVID-19 patients right now. And we just started calling, and we started with California, and we're doing our best to contact sort of the point person at each hospital for this topic, but that's a little bit challenging, right? So the same way that things are really turbulent in our own personal lives, like hospitals are really being challenged right now. So we're doing our best to speak with like an infection control nurse or the head of purchasing or something like that to understand each hospital's individual policy. And then any hospitals that are saying, yes, we are including on our list and our public facing list that all of you can access. And we are including any instructions, like if they specify a pattern that they're interested in, we link it on the list. And we also include delivery instructions. So
it's really great. Yeah, it's a great list.
What to do.
Yeah,
thanks.
It's really, I mean, it's amazing how, and I think, you know, there's a cat in the way. I think that what's interesting is what I'm hearing from quilters and from sewists are a couple things. One, who needs them, which is what you're doing, and then what pattern to use. And what's so nice about your list is if there is a specific pattern, you're putting a link to it. So that's really super helpful. Do you think obviously, we'll have so many questions. First, are you seeing any kind of like solidification of what kind of pattern, or is it still it's completely chaotic from what I'm seeing, what people are suggesting?
So I think I'm seeing, like, we've called mostly California, and in California, they're sort of just starting to understand this possibility. And part of the work that we're doing that I was surprised about is we're actually educating some of the hospitals about this opportunity, right? So I've like talked to hospitals about it, and they say, this is really interesting, send me an email, we're going to get back to you about it on Monday. So that's like a part of our work that we hadn't anticipated.
Yeah.
So obviously in situations like that, the hospital isn't going to have thought through what kind of pattern they
right, they don't know.
Right? And
yeah, so,
exactly.
And I think what's so interesting about this, is that it's like we need someone like you that can bridge the discourse, because hospitals have a certain thing they need, but they don't know about like the quality of our fabric, or that we have interface, or that we have non-woven. Like there's this kind of strange moment of like the quilters saying, well, what do they want? And the hospitals being like, we don't usually have to figure out what we want, right? They just show up at our door. Like we just order them. So I think that's really interesting. Do you see that disconnect too?
Yes, definitely. So in the cases where they've sort of been asking me for information, I've shared what other hospitals have done. So like the pioneering hospital in this space that we all know about is Deaconess. And they obviously had a pattern that they were publicizing, and that pattern, a lot of hospitals are sort of jumping on board with that.
Yeah, that's become a really. And then the button collector pattern has also become pretty, because it was on Rachel Maddow. It became like a big one too, right?
Yeah. So some hospitals are jumping on that one as well. I would say from the hospital perspective, so far, like the greatest sort of organized effort that I've seen is from hospital groups in Minnesota. I'm not sure if you've seen their link.
Tell me about that.
They have a very centralized, like organized system between Alina and Blue Cross, I believe.
Okay.
And they have, and you can find all that is included in our list as well, but they have a pattern. And they also have like a lot of community drop-off centers, which I think is really cool and interesting.
Uh-huh.
And
let me take a look there. So for those listening, I just put in Minnesota face masks, and it came up, and it's Alina, ALLINA Health, Blue Cross, and Blue Shield call on public's help for face mask donations. This is incredible to me that these groups, think about Blue Cross, right? This is crazy that this is happening. But you see that if you go to their website, which is, they do have instructions on how to make a hand-sewn mask. Let's take a look at it and see because I think what's happening with the quilters is we want direction. Like, we're good at directions. We're good at, like, we don't want to make it, but you know what? It doesn't go to, hold on. Instructions it's sadly their website, it's going to the wrong link. It's just going to a general. Let's see if it's down below. Did they put it? No. No, it's just a really general thing. There we go. Donate mask. There we go. Okay, cool. Instructions for hand sewn. Okay, here we go. Okay, they just want you to gather it on each side. It's a very simple pattern. Like, all it's saying is to cut the fat. What does it want you to do? It wants you to do rope, elastic, beading cord, or anything 7 inches long, knotted at the end. So it's very much like the other styles that we're seeing, right? That it's just a basic hospital mask. It doesn't have a lot to it. You gather on the ends, and then you make loops on each side, basically. Is that what you're seeing? Is that these masks are really simple? This one's a 9x6, two pieces of cotton.
So it's a pattern, but it's a pretty basic pattern. But yeah, most of the masks that they're asking for are extremely simple. Like, I got an email this morning from a nurse at a major hospital in Michigan. She works in a NICU setting, and they're starting to take all of the babies whose mothers are suspected or have tested positive for COVID-19. And their hospital doesn't have an official policy for masks right now, but the nurses are being told that they can bring bandanas from home and use them.
Oh my goodness.
So I think...
that's craziness.
So I think... the patterns are pretty basic, but the need
is great. It's real.
The need of even the improvement of a simple mask relative to a bandana tied over your face is huge. Yeah. And this is the reality that this is a major hospital system in Michigan. I was completely shocked when I got this email.
Yeah. Yeah, it's real. It's so the other thing that I think that, so I've started we have a site called Million Masks a Day, and what we're really trying to do is see who's making them, provide information, be a place that people could come to just sort of document it. I'm a law professor and a cultural historian by training, and so and this project, JustWannaQuilt, comes out of Tulane Law School because we look at intellectual property and issues in culture. Anyway, so again, I get when you say that you're like on one side, and then sort of being able to having a foot in both worlds really makes a difference in terms of this. So I think that what your list is doing is validating sort of what we're doing, because a lot of people, I think, still think we're being ridiculous. And I think that, having it on the Rachel Maddow show, having others, having Blue Cross Blue Shield say we need these is really important for the legitimacy of sort of what crafters and quilters are doing. And so I think I'm wondering what your thoughts are about that side of it.
Definitely. I mean, the line that I've been using when I get pushback is like, I agree with you. Like, I do not want nurses to have to use these masks.
Right.
Like, I want nurses to have as many N95 masks as they could ever possibly need. That's what I want. But I'm also very sympathetic to the reality of the nurses that are contacting me and saying, I'm scared.
Yeah.
And the nurses that are saying, my friends are getting sick.
Yeah.
And I understand that these masks that we're making are not going to, defend them from the actual virus. But what they can do is they can extend the life of the N95. They can prevent droplets from being spread. They can be used for patients so that the nurses can use the stock of the medical masks. Like, there are so many ways that these masks can help that just poo-pooing them and saying they're not N95s is not useful, in my opinion. And I think, like, the fastest way to shut down anyone who's being discouraging right now is to show them the list.
Yeah.
To show them the
That's right. I mean, I think I think that's why you're doing that. That's why I think that's just so incredibly impressive, because the fact that we will have a documentation of this, I mean, you can kind of see it. I mean, I don't know about you, but as being a Ph.D. student, like, you can, I keep thinking, like, this is the research we're going to be working with, like, once we're out of this crisis, right? So to sort of say what happened, like, in this weird blip of a moment. Now, do you feel that way too? I feel like there's, like, we're learning and we're archiving so that we can understand what happened once we're out of the chaos.
I don't think I've sort of had the mental space to step back like that. Like,
interesting.
Your point is well taken, but I feel like right now, like,
you're in the middle of it, right?
I'm in the.
That could be like our age difference, because I did my PhD. Like, I've done this. I've been around a lot. So I mean, I feel like I see. The other thing is, as a cultural historian, I feel like we need to document and preserve what's happening, because it is very hard to recreate this moment if we don't do that. So lists like yours matter for the historical record that we're creating by people making things. So that's also really why we started the space we did, because as you said, it was all chaotic, and I wanted some place where people could keep dumping whatever they found so that we did have a historical record of this moment.
And that's really important. And I just want to, circle back and make one more point.
Of course. Yeah. Sorry.
No worries. And that is that, like, we are also sending this list to any factory that's saying they're manufacturing face masks, like medical face masks, to any factory that's saying we're going to start making N95s, and any call of people saying we have medical masks, where should they go?
That's great. That's really great.
We see, we're sending it there too. Like, this
fantastic. It's so fantastic. So so that was my other line of questioning. Having been sort of on the front line of this, do you see companies, do you hear anything on the street about companies stepping up, or that masks will be coming? Because we're getting a lot of mixed messages of sort of, is this a gap, or is this like what are you hearing about sort of what's happening in the world?
Yeah, so I struggle to speak with confidence to this issue, as I think a lot of other people do, but I think that there are companies that have publicly announced that they are shifting their manufacturing right now. And I think that I don't think anyone in this country, because of the fragmented nature of what's happening and because of the fact that prior to this crisis, the majority of masks were manufactured in China, which obviously also has a huge need right now. The shift towards American manufacturing should help to meet the huge demand that we're seeing. But I think at this point, because I'm seeing such a disparity in the projections, it's really hard to know.
It is hard to know,
And that's another great thing about the masks that we're making is that they can be laundered. Right? So, you know, when you make a mask, if that facility has the capacity to launder it, you're buying them even more time. Than a box of masks would.
Right. Okay, so a couple of questions that we're getting a lot. Is 2 pieces of fabric enough? Are you trying to make a pocket to put something in it? What are your thoughts about that?
So my thoughts are, obviously, like, the number one thing is that find a facility in your area and follow their lead. Like, that's my primary recommendation is, like, look at the list. If we linked a pattern, then use that pattern. In the absence of that, my reading of the state of the literature, like, in the mask, I want to make masks too. I just haven't had time because of all the coordination I'm doing. But if my plan to make them is to use 2 layers of tightly woven cotton. I have a huge stash of flannel that I was planning to use because it's soft, it's nice and tightly woven. And
you think flannel's okay?
I think that flannel's okay. Really, it's 100% cotton. It can be sterilized. It's tightly woven. It meets the recommendations that I've read from the literature that where they've studied this in sort of low and middle income countries and the relative effectiveness of materials. But I also include a layer of lightweight interfacing in the middle.
You do?
I do. Because I think that it's a nice facsimile for the highest performing materials. And I've tested it on myself, and I don't think that it inhibits breathability too much. If you
do a light interface. Now, some people are suggesting that you do each side a different fabric so that people can know, when they're picking it up, they know which side is the out-facing side and what's in-facing. Do you think that matters?
I think that's a great recommendation. I think it's less necessary if you're doing the ones that have sort of the bias tape on the side so that the elastic comes inward. Right? So those ones, it's a little bit more clear, but I think if you're just doing like standard elastic, I really like that recommendation. And one thing that I've been wanting to do and haven't gotten a chance is just to write a little thank you in some way, like maybe with a fabric pen or if there's cricketers, to do it small, just something that when they're in the thick of it reminds our providers that they're not alone and we're thinking about them. And
so a little message in the mask saying you're not alone or thank you. Or now, do you think like a Sharpie would work if they had just a Sharpie, or is that not going to be okay in terms of washing?
That might bleed in the laundry. So I think like if you have a fabric pen, or if you have like a Cricut or another vinyl cutter, and you could do like a tiny little message on the side, it probably won't last long because they're going to launder it with bleach. But if they see it once, to me, it's worth it.
Got it. And then the bleach thing, because they're bleaching it, do you have a sense of like, does it matter? I mean, what is the bleach going to do to it? Is it going to like take out all of the color of the fabric, or is it just going to be like, what is it going to look like? Like, what kind of fabric should we be thinking about?
So I've seen mixed reports on this. obviously, like, hospital gowns are colored and they are bleached. So not all colors will run, because I believe they use like a 9% bleach solution. But I think, like, at this point, this is what our stashes are for, and if you have it, like, you should use it, right? You know, even if the colors fade between washing, it's really function over form.
Yeah.
at this point.
Yeah.
And
it's function over form. I think that's a super important message, because I think that as sewists, we get really fixated on, like, well, getting it right. And I don't think it's about getting it right. It's about mass producing as many as you can. Is that right?
Yeah, I mean, yeah.
It's not about perfection. Like, think about quilters, right? It's not about perfection. It's about functionality. Correct.
Like, anytime you're, like, getting stressed out about seams looking pretty, like, think about that poor lady in the NICU that emailed me that's saying, like, we're desperate.
Yeah.
And produce the highest quality that you can in terms of function, and just, like, nobody's going to win a prize for prettiest mask.
Right. Okay, so a lot of people have been talking about the fact that they either don't have or they're running out of elastic. And so what are your thoughts about ties instead of elastic?
Yeah, so I think there's a lot of things that you can think about with elastic. I've seen people find, like, elastic headbands and cut those up, like thin elastic headbands, which are still available in some places.
Like ponytails, right? So cut the ponytail in half?
If they're large enough.
Got it.
But if they have the headband size ones, I saw one lady post about Dollar Tree has a pretty big stock right now of just, like, large elastic skinny headbands that are like 3/8 inch.
Yeah.
So that's a good alternative if you can't find standard elastic. The elastic doesn't have to be white. So I think white sold out first, and then people forget, like, there's black and there are other colors that you can get. And I think you can always use ties. Like, a lot of people that I know have big bias tape stashes from, like, random projects over the years, and I think that's a great place to go once you run out of elastic, is, like, the pre-made bias tape.
Yeah.
And then after that, like, that's where I would go. So, like, first I would use my elastic stash, then I would use my bias tape stash, and then I would go to just making my own bias tape.
Making your own bias. And I think with quilters, because we make bias tape all the time, that makes the most sense for a lot of people to just make it, because we do it for the binding on quilts all the time, so, as you know. So I think, but don't get hung up on, okay, the other question I get all the time right now in the last few days is sizing. So we did some sizing strategy in our house, and so the question is, like, I guess it's 9x6. Like, should they always just be 9x6, or, you know, are you trying to make them for little ones or for bigger heads, or what are your thoughts about sizing?
So for sizing, I think the 9x6 standard size is a great place to go, but we are seeing calls from children's hospitals.
Interesting.
So children's sizes are smaller. There are some good examples of children's sizes.
Yeah, and this Alina Health one in Minnesota is saying adult is 9x6 or child is 7.5x5. So that helps you. So that's interesting. So I don't know if it needs to be smaller than that, but that's what they're suggesting on this site that we went to. Hi, I lost you.
Is being recorded.
Hi, I'm so sorry.
That's okay. It happens. It happens. So we'll just. That's why we're not live. Okay. So sizes. I think we were on sizes. What are your thoughts? So we said children's sizes. Do you see anything where, like, the size that you need bigger sizes than they are, or just the standard size is fine?
The only thing I've seen about larger sizes is just to make the straps or the ties longer.
Yeah.
But I haven't seen anything about a larger adult size than we discussed.
Awesome. And anything on the ties? Have you seen how long the ties are? Is there a standardization of that yet if you're doing ties?
I think, well, since most of the hospitals have been asking primarily for elastics, and then some of them have been updating and saying, we'll take ties, and then there's other hospitals that are saying we'll take whatever we can get. I haven't seen.
You haven't seen anything.
A tie length from a hospital, but I really liked the Sweet Red Poppy tutorial that she released
okay, hold
yesterday.
On. Let me take a look at that. Sweet Red Poppy tutorial?
Yes. She has a good one, and so does Kid Giddy.
Okay.
They both have good ones with ties, and I trust them as good researchers to have found good lengths on them.
Cool. All right, cool. Awesome. Right, so that's super great. Right, the ties. Look at that. Perfect. Wow, look at that. That's really great. Okay, well, now the last question I have for you is how can we help? So you're making this list. How can we help? We have law students. We have the Quilting Army, which is about 3,000 quilters. We have this new Facebook group. We have another group that's 37,000 people, Quilting on a Budget, that Seth runs. How can we help you?
So I have a list in front of me of 4 ways to help.
Okay. Number 1.
So, number 1, the first way is to share the list. So share the list in your own social media feeds. And also, another great thing to do, I'm only one person doing this, so to have assistance would be great, is share the list in the feeds where you see people talking about masks and where to donate them.
Got it.
Comment with the list. I could use a lot of help from people who are on Twitter doing this because I'm not as good of a tweeter.
Got it. And what about Instagram? Do you feel the same way about Instagram?
On Instagram, there's not as much back and forth, and you can't share links, so it's a little bit harder.
It's a little bit harder, right?
Yeah, we do have some Instagram-heavy bloggers that are gearing up to share the list, so that's going to be positive. But I would say, if you're looking to make the biggest bang for your commenting buck, Twitter and Facebook would be amazing. So it's not just me trying to do it.
Yeah.
myself.
Yeah.
The other thing that you can do, the second thing that you can do, is tag me when you see public calls from hospitals. You can tag my personal account, which is Alexa, Alexa, Mageri, Magyari.
All right, say, sorry, Alexa. So don't say your first name because there's an Alexa sitting next to us. That must be really annoying for you.
Yeah, it's not my favorite thing.
Okay, so just spell your last, because so somebody rudely interrupted. Tell me, spell your last name again so that people can hear it.
Yep, it's Magyari.
Cool.
It's a tough one. And if it's easier, you can also just tag my business account, the Wannabe Grandma.
Wannabe Grandma. That's a really good, easy one for us. Okay, so Wannabe Grandma, and wanna spelled like us, just wanna quilt. So Wannabe Grandma, and you just want them to put, if you're in a Facebook post or anywhere, you want them to put a hashtag Wannabe Grandma, right?
No. So if you
just put at Wannabe Grandma.
If you see a hospital system post where X hospital on their Facebook page is asking for masks, tag me in the comments.
Tag you in the comments, and just in case people don't know how to tag, tell us how to tag in a comment.
In a comment, so you do the @ symbol, which is shift and the number 2. And then you start typing either my name or the Wannabe
Yeah, let's just do Wannabe Grandma. I think that's easy for people. So if you see a hospital asking, or any group, because there was some EMT groups and firefighters, there's other people asking for masks too beyond hospitals, right? So
yes.
And so if you see anyone asking for masks in the comments, do a shift 2 and then do Wannabe Grandma, and as you type Wannabe Grandma, it should come up Wannabe Grandma.
Yes, And to be clear, though, please only tag me if it's coming from an official account. Like, unfortunately, like, we need to maintain...
this is an official list. This is not like somebody heard this is a need or whatever, right?
Exactly. Yeah. So if it's like your local police station on their page said we need these masks for our first responders, that's the money. That's where I need people to help me.
Awesome. Yeah. If you see something that's just anecdotal, you can still put it on our site, which is Million Masks a Day. Also, if we see stuff on Million Masks a Day, we can tag you. So we can have a part of our admin people continuing to look through that to see if people are, so we're trying to catalog everything that's happening, so we can sort of see if that happens. So if you're on our Just Wanna Quilt site, or if you're on the new site that's collaborative with Quilting on a Budget, that's the Million Masks a Day, and you do see official call on there, tag Alexa and see, Alexa, stop. How do you, like, live? Like, this is very frustrating. Like, do people not say your name anymore when you're, like, in their houses with certain machines in the house?
Yeah, it's not great. And, you know, like, everyone thinks they're the first person to make the joke about, like, asking me to deliver them a pizza.
It's terrible. That's so not fair. Right, yeah. That's not, it's a burden of cruelty because, like, your parents this wasn't around when your parents named you, so this isn't cool.
There is one, like, positive benefit of it, though, is that now people know that name. So, like, before, like, I would be called, like, Alex or Alexis or...
Right, they didn't know your name. Right, now everybody knows how to pronounce your name. That's funny. I bet there's, like, no babies born with that name, like, starting at a certain time.
Yeah, no, any of my children will have, like, pretty standard names that would never be turned into anything like this.
That's very funny. Okay, so number 2 is tag Alexa. Alexa, stop. Sorry.
It's okay.
That's really awful. Tag Wannabe Grandma if you see anything official out there. So Quilting Army, do this because this is going to be super helpful to the person we can't name. Okay, so number 3. What's number 3?
So number 3 is if you're a hospital employee who needs masks, you can have an administrator email us. And we have the email address and the full instructions for the information that we need in that central document right
awesome.
At the top.
Can you give, in case they don't have, they're just listening and they're like going into work or they don't have a way to get to it, can you tell us what that email address is? Do you want me to, I'm on that. Yeah.
Yeah, so it's we.need.handmade.masks@gmail.com.
Okay, so do it one more time in case people didn't get it.
Yep, it's we.need.handmade.masks@gmail.com.
Awesome. Super awesome. So any information you have in terms of an administrator or an official note from a hospital or a medical emergency group, they can email that to you, and you're going to ask them 4 questions, right? Is it 4, 5, 6 questions?
Yeah. So we're going to ask them like how many they need, if they have a specific pattern that they want, or any other like requirements of the masks.
Yeah.
We're going to ask them like the instructions for how to donate.
Right.
And we're also going to ask them to follow up with us if the need is met, and we'll remove them from the list.
That's
great. Because it's very important that this list, it's very important to me that I make this list reflect the need as much as humanly possible.
This is really fascinating.
Hard.
Yeah. This is amazing. Okay, and in terms of that need, and we'll get to number 4, would you mind, once you feel like you're done with the crisis, if we stop having to make masks, would you contact me and, like, can we have a follow-up interview of sort of what happened and how the need was met and sort of just kind of a debriefing? I think people would be really fascinated to hear sort of what's happening once we're through this crisis, if we can get through it.
Yeah, of course. I would love to.
Cool.
Love to talk again.
Okay, cool. Awesome. Okay, number 4.
So the 4th thing that you could do to help us is if you're interested in being one of the callers. So we have 14 active callers right now for 5,100 hospitals.
That's craziness. You need more people.
Yeah. We could really use more people.
Okay.
We're looking for people that have good communication skills, attention to detail, and are very motivated to be long-term in this position. I mean, I'm not talking about years, but I'm talking about like if you sign up to help us contact a hospital, you're accountable to checking back with that hospital, to that hospital calling you back with more information. And like we need people that are not gonna you
need dedicated people. You need us. Yeah, we can help you with that. The other question I have is, are you doing it by state, or how are you dividing things up?
Yeah, so the rollout is a really good question. It's something that I have been thinking really carefully about. So because we are in California, we sort of are working on California as a proof of concept. I started this on Friday at like 4 o'clock.
It's so insane, right?
It's Sunday now.
I know. Have you slept at all?
It feels like I was telling my boyfriend, like, I can't believe it was yesterday. Last night I was like, this is insane. Like I feel like my life is like a totally different thing. But so in the first 30 hours we called 100 hospitals.
Right. That's a lot. But there's a lot more to go.
Right. And we were able to identify 16 unique new hospitals that hadn't put out a public call to action, but are desperate for donations.
Yeah. Okay. So that's interesting. Okay. So what I think we should do is, if you could help me, if you can write a post of a call to action post for me and help me, and I can do that as well. We'll put it up on our, so the Quilting Army is incredible. They're I just want to brag about them for a second. So I started this project 2 years ago. We made a Facebook group because we were joking about that we're a quilting army, and I'm a really regular quilter. They've helped proof books. They've jumped in. They do stuff. They're smart, very, they're just awesome. They're insanely awesome. So I think if we start there and see if there's any volunteers for that, you'll get a really high quality group. Because I've seen them in action. They're amazing. So let's start there, and also we can publicize as much as you want. I also think that turning to the quilting community, the leaders of the community, to let them know about this might be helpful too, to help them to get support and get the message out about making the masks, which is, I guess, imagine your fifth one is make masks. Right? Yes,
make masks is, I sort of am a little hands off on that. I think that you all have an amazing, I've just been overwhelmed with the response of the crafting community, and I'm so grateful to everyone. And I think my competitive advantage here is just thinking about distribution and thinking about these kinds of questions. And if there's sort of one thing I would ask of the quilting community is just I love the enthusiasm, but we are figuring this out as we go, and sometimes it's a little bit challenging because within hospitals the message isn't necessarily clear. So I've had a few instances of people will call a hospital that's on my list, and whoever answers the phone will say no. We are striving really hard to talk to the highest ranking individual at that hospital. Yeah. And are you giving training to them about how to do that if they sign on? Because I think that would also be something that's helpful. Do you have directions on how to get to that highest ranking person? Yes, that's so funny, because right before I came on this podcast, I told my sort of right-hand lady right now, the thing I'm doing after this is writing even more formal directions. I've written up some formal directions, but they were sort of for a group of 5 of my friends. And as this has been taking off, it's becoming clear that we need these clearer guidelines. And we're narrowing down the list, but the acceptable people that we're going to talk to are going to be things like infection control nurses, head administrators, directors of emergency rooms, office managers of individual practices.
Yeah.
And people like at director or administrator or head purchaser level. So we're striving to do that. We are going to be better about documenting on our end who exactly we talk to.
Yeah.
So
that's great. So that you have a record of it. So if people are right.
Right. So I apologize to anyone who's sort of running into contradictory information. Like, we need to be patient with the hospitals as they try to figure this out right now. Yeah. And they may not be disseminating the information to all of their staff. But I do appreciate the feedback, right? So if you are having these experiences, let us know, and we can always follow up with the hospitals and give them that feedback that, hey, people are trying to bring donations and are being sometimes discouraged. So that's like sort of a hospital issue that we can help make them aware of. But like, we really appreciate your patience and your enthusiasm about these type of issues, but just know that like, we are absolutely hearing you on this, and we are doing our best to like prevent any of those sorts of problems.
Well, this has been great. I appreciate your time. I know you're super busy. Anything else before we go? Did you live in Berkeley or in Oakland? Are you still there?
Yeah, so I live in Pleasant Hill, California, which is a suburb in the East Bay. Right now. And to anyone in the Bay Area, like, I really want to urge you to make as many masks as you can. Like, because we started in California, the California problem is sort of at the top of my mind right now.
Yeah.
And
Louisiana, I mean, we're in New Orleans, and we're number 3 behind Washington and New York right now. So it's not good.
Well, we have a Louisiana calling captain that just signed
We do.
on.
Well, will you put her in touch with me? I will help. Yes, we will do what we can. We like that.
Yeah, so I think the one thing, I want to add one other thing, to look out for.
Yeah.
From me, as from time to time, I may reach out for people in individual areas to serve as collectors. Like, for example, in the example that I gave about the Michigan Children's Hospital, that hospital does not currently have a policy on the homemade masks, but they are allowing their nurses to bring them. So we can't go like drop a big donation off in a hospital, like an official hospital capacity, but we could give them to a nurse to distribute among nurses, if that makes sense. So we would need sort of a captain in a geographical area to collect for the nurses, and then be in touch with a nursing representative to distribute to the nurses directly, right? Because the nurses can bring their private property, but
got it. But they can't bring someone else. Got it. That's really interesting. Yeah. Okay, so, cool. Well, that's really helpful to know. And your site is your document is so helpful because it does tell you how you can drop it off, or what's the process of doing that. So that's super, super duper helpful.
And I just want everyone to not forget about the homeless community as well. One of the biggest responses I've gotten is from directors of homeless shelters, because individuals who are experiencing homelessness can't quarantine like the rest of us can.
Yeah.
They have a huge demand for masks as well. So we're including the homeless shelters that contact us, but we're not actively contacting homeless shelters. So keep those facilities in mind.
Yes. Good to know. That's really, really, really helpful. Well, you are, you're amazing, and I'm so impressed and proud of the work you're doing, and I know it's really hard. We've been just doing a little bit of it just to sort of, again, gather and have a place to post all this stuff, and that is exhausting. So I really, it's a lot. So I really do appreciate the work you're doing, and we're on board to help in whatever way we can, including starting with the podcast to try to get it out to people to let them know what you're doing.
Yeah, thanks so much for having me. I really appreciate it.
Cool. Well, reach out to me if you want to come back. If there's any updates or anything at all, it's super easy just to jump on. Obviously, we're all home, so there's no, so good. Well, again, super impressive, and I'm so glad you're doing this. And want to be a grandma? You're awesome. You're so insanely awesome. And again, we'll help in any way we can.
Great. I really look forward to working with you all.
Cool. And are you okay with us posting? You don't need to review it?
Oh, yeah. I mean, I don't think you're going to try to give me some sort of funky edit.
No, we're just a law school, so we always ask. I'm a law professor, so my legal hat comes on. I just want to clear it. Okay, hold on. Don't hang up. I'm going to turn off the recording. All right. So to recap, we're in a funny little time right now where we are being asked to make masks. It's not as a replacement for fancy masks. They will be coming, but right now we just don't have enough. So Alexa, stop. The call to action are 5. 1, share the list. We will be posting the list with the link to the list with the interview. Number 2, tag any official post you see with hospitals or other emergency-related people. It has to be official, but tag it wannabe grandma. So do it @ with wannabe grandma. 3, I didn't write the 3 and 4 down. 3, I can't remember 3. 4, if you want to be part of the list, the people that help, reach out. So reach out to wannabe grandma on Facebook, or message me and we can get in touch if you're willing to call and be one of her main people that help with the 5,100 or whatever or plus hospitals. They've done 100. She needs the army. She needs a lot of people to help them and be dedicated. And finally, make masks. So it doesn't matter. Don't get freaked out. They don't care. Some hospitals care. Look at the list. Others don't. They need masks. This is hopefully a short-term problem. So don't get hung up on how pretty they have to be. They need masks, whether they're elastic or with ties. They don't have to be fancy. They need kids' masks at children's hospitals. They need regular size masks. They need masks. So get out your stash and start making them until we see that the supply has been replenished. Oh, what a crazy world we live in. All right, quilters. All right, quilting army. Let's get working. Oh, and one last thing. Seth Hackler of Quilting on a Budget and I have started a special Facebook group because we were getting inundated in our own groups called Million Masks a Day. What that is we'd love for you to post what you're seeing, what you're doing, any information. We're trying to gather information there to see what's happening in our community. We know Joanne's is stepping up, and that's a drop-off point in many communities. There's just a lot going on. So again, Million Masks a Day. Join our Facebook group, help us keep informed, and we'll see what happens next. So you've been listening to Just Wanna Quilt, a research podcast coming out of Tulane University Law School, and I'm Elizabeth Townsend Gard. If you like this podcast, keep listening. Also, we have a Facebook group. Come join us. We talk about a lot of things. We also have an Instagram account, and of course, most importantly, I really hope you get a chance to quilt today.